Hello, everyone. I'm Megan McGurman.
And I'm Jason Tokarski. Welcome to another episode of For the Love of Health, brought to you by Deanna Care.
Have you heard of the term healthcare pollution? It refers to the waste that hospitals produce while providing patient care, as well as hospitals' carbon emissions.
To tell us more about the caregiver-led initiatives to help minimize Deanna Care's footprint, are nurse practitioner Deanna Benner and nursing professional development specialist Ashley Oncay.
Deanna and Ashley, thank you both so much for being here today.
Thank you for having us. It's our pleasure.
At Deanna Care, one of our core values is using resources wisely and effectively. Deanna, you're one of the leads of the Deanna Care Environmental Sustainability Caregiver Committee. Talk to us about how this committee really shines a light on that value.
The healthcare industry in the United States contributes 8.5% of our total carbon emissions and makes a lot of healthcare pollution as well. This committee is made up of all the disciplines of caregivers across Deanna Care, from nursing to facilities to nutrition and so many more. So we come together in the committee and we help decide what are the best interventions that we can do to reduce our environmental footprint. And then we rely on eco-champions to really help us carry out that work. Eco-champions are a self-designated role by individuals who just want to make their care area more sustainable.
I am one of the eco-champions for the operating rooms at Deanna Care and am able to use that role to really look at opportunities that we have to decrease our waste.
We have two programs that we really rely on eco-champion support and their contribution to make them successful. That is the medical supply donation program and the landfill diversion project.
All right, let's start with that first one, the medical supply donation program. Give us a little more detail about what we're talking about there and how that works.
Well, as nurses delivering care, we realized there was so much waste that was being discarded through opened, unused, or expired items that were just being discarded in the trash. I thought there must be a better way. So I called Project Cure, which is a nonprofit in West Grove, PA, that collects medical supplies and donates them globally to resource-needy areas. So I asked them if they would like our supplies, and then they said yes, and then we just started collecting. And Ashley actually volunteers at Project Cure.
So through volunteering at Project Cure, I was able to determine that a lot of their expired supplies that we were donating were being thrown away. They couldn't get them through customs when they would send donations. So Deanna and I and our team kind of thought creatively, what can we do with these expired supplies? We don't want them in the landfill. Somebody can surely use them. So that's where we decided to donate to local nursing schools, local allied health schools, local VOTEC high schools. Also, internal educators have used our supplies.
So we have this process of collecting all these supplies, and then our small team, we separate them into expired and then non-expired supplies. And then from there, we inventory them, especially our non-expired supplies, because then we can show the financial value of what our hospital is donating to Project Cure.
What kind of impact are we having globally with these donations that we're making?
We started this program in February of 2024, and since then, we've donated over $140,000 worth of unexpired medical supplies to Project Cure to be distributed globally.
That's fantastic. And the second program you mentioned, the landfill diversion project, sounds pretty self-explanatory, keeping things out of landfills, but what does that actually mean?
Our waste that we're always trying to reduce, it goes to the landfill very close to off of 495, the Cherry Island landfill. So our waste goes to our local community. And so it's so important that we're mindful about what we're sending to the landfill. There was a recycling trailer in the back of the Newark campus, and it was supposedly large items that were going to the recycling facility to be recycled. But it turned out that those items were not being recycled and they were actually going to the landfill. So when our small team figured that out, we used a trash pick. We used to go onto this trailer and pull off chairs, desks, pictures, usable items that we didn't need here at the hospital anymore. And the only way people knew to get rid of them was to put them on this trailer. We did this enough, and our wonderful team that works on the ground floor of the hospital, they kept seeing these 3 nurses moving all of this furniture practically 2 or 3 times a week. And then one day we came in and they painted the wall for us in the basement to say repurposed goods. And that was like the first time where we realized like we are really making a difference. And the program just continues to grow. So from the items from there, we donate them to Habitat for Humanity. And what are some of the things we've collected recently?
So for Habitat, lots of desks, office supplies, chairs, filing cabinets, bookshelves, things like that. And then anything medical supplies, we kind of prioritize for Project Cure because they also look for those things. We've been able to donate exam tables, beds, stretchers, OR table mattresses. We've crash carts, all kinds of supplies and things like Deanna said that we just don't have a need for right now, but they can absolutely use.
It keeps growing, this program. Like there's a refrigerator down there today, and a refrigerator for meds in a third world country can make a huge impact. So we during our work, we just keep communicating with everybody down there, just anybody we meet about what we're doing. And people join us, and all of a sudden we get new items down in our area that we can donate.
You had shared with us before we sat down that you're even giving printers to local school districts. What has the feedback been like from these organizations who are receiving these items?
The printer program, that is one that we're really proud of. So the printer optimization program was just recent at Christiana Care. So we worked with the IT team to have access to the 400 printers that really would just go to electronic recycling and the landfill. I just started cold calling school districts and saying, would you like our printers? And the one school district that I'm most proud of was the Chester Upland School District. And they received 4 pallets worth of printers, and we're so incredibly grateful for them. So now teachers can print out papers in their classrooms, and these printers are still useful, and it's been a wonderful service.
To add to that, some of the organizations that we've donated other supplies to have provided feedback that they are now able to allow the students opportunities that they wouldn't have been able to before because financially their budget just didn't allow them to purchase these items. So it also makes simulation lab more real-like, more lifelike for these students.
So many of these programs we could not do without collaboration with our environmental services team and our supply team. And the printer donation program, we really relied on the collaboration with our supply team and the logistics center. So we had everything sent to the logistics center for easier pickup. And one of my favorite moments is when Robin, who's like this awesome member of the supply team, he was helping me distribute it. And he comes back in and he says, we just gave a printer to the camp that my children go to during the summertime. And it was so neat to actually, like for him and for us to know like, hey, we are helping our community so much.
It seems very fulfilling for both you and those who are receiving these products. What is the financial impact of all of this?
So we're very proud to announce that we have just hit the $1 million valuation of the donations that we have sent out. So that includes both expired and unexpired items.
And all the items that we've given through our landfill diversion project as well. Yes. But Ashley and Val Rhodes, they really get all the credit for the meticulous documenting of the supplies, especially the expired supplies coming out of our operating rooms. And that's where we realize we have the most opportunity to be impactful in reducing how we order and how we use our resources wisely so that they don't expire.
Ashley, you work clinically in operating rooms now. Thinking back to when you started getting into that and when you were starting your career, did you have any idea of what kind of waste exists in that operating room situation?
No, not at all. So, we all get into healthcare because we want to do good. We want to help people. It's not really something that, at least when I went to nursing school, that was talked about. We focused on patient outcomes, patient experience. And, there was, I feel like, a little bit of a drive to disposable items for, maybe infection prevention purposes. So a lot of things that used to be reusable are now disposable. And I recently read a study in one of the AORN journals that said, it really kind of put it into perspective. It said that one surgery produces the same amount of waste as a family of 4 does in an entire week. And when I thought about that, I am a family of 4, and I've been in the OR for a very long time. It's pretty accurate. I mean, I can see that. So that's another kind of thing that really drove me to helping with this program, helping to try to decrease this waste or at least find another home for the waste so it's not in the landfill.
Deanna and Ashley, this sounds very grassroots. Talk to us about how this got started.
I think for me, it started out of maternal love. I have 4 children, and my 3rd child, when she was 14, had severe eco-anxiety. So I started to learn about climate change and the environment to see how I could help her. And I was so surprised that our healthcare industry that I love so much contributes so greatly to climate change with a total of 8.5% of our greenhouse gas emissions. And we make a lot of waste. So I set out to make a difference and knew that there had to be ways where we decrease our environmental impact of healthcare delivery.
And Deanna and I were able to meet through volunteering at Project Cure. And with my experience in the operating room and seeing all of the waste firsthand, we really were able to come together and build on Deanna's idea of a medical donation program and use some of Project Cure's mission as a backbone of the program. And we couldn't have done it without the support of Christiana Care leadership, from environmental services to supply chain and executive leadership at Christiana Care.
What is your message to fellow Christiana Care caregivers or other healthcare organizations across the country who are listening to this saying, like, oh, maybe we should be doing this. Maybe I should be getting involved in this?
Every person has the potential to impact and to do what we are doing of reducing the environmental impact of healthcare delivery.
If you are a Christiana Care caregiver who's interested in helping, you can go on the Environmental Sustainability SharePoint site and become an eco champion. Right now, the medical supply donation program is only live on the Newark campus, and we would love nothing more to expand. It will be expanding for our Cecil caregivers to Cecil very soon, but we are looking for help.
And we've accomplished this $1 million milestone by just this very small team. And what the change that we could impact if we all work together and we get more caregivers coming would be just substantial. And it could be change that extends beyond healthcare to reduce our carbon emissions and to make the world healthier.
Deanna and Ashley, thank you both so much.
Thank you.
Check out the show notes for today's episode to learn more about Christiana Care's environmental initiatives.
And you can always keep up with For the Love of Health on social media. Just search at Christiana Care on your favorite platform.
We'll be back in 2 weeks with another great conversation.
Until then, thanks for joining us for the Love of Health.